Welcome to the Balanced Blood Sugar Podcast, where we focus on everyday wellness for everyone. I'm Adrienne Wheat, a registered nurse, here to share tips, habits, and lifestyle shifts that can help you feel your best by stabilizing blood sugar and improving your overall health. Everything we discuss is designed for general health and routine education because everyone deserves to feel empowered with the right information. But I'm not your personal nurse, so make sure to check with your healthcare provider before making any changes. Let's dive into today's episode. Welcome back to the Balanced Blood Sugar Podcast. I'm Adrienne Wheat, your host, and today we're diving into part 4 of our gut health series. And now, if you're new to our channel, this is not something we typically talk about, but because our blood sugar is so tightly linked to systemic inflammation, understanding how your body holistically works together as a whole unit instead of individual parts is so incredibly important. So I encourage you to go back, listen to the earlier parts in this series, listen to some of our other episodes to get a better feel for our channel. We're very much into holistic wellness as it pertains to helping you manage your blood sugar. So today we're diving into part 4, and this is especially for you if you have ever felt bloated or gassy all the time, even when eating healthy. If you've ever had chronic constipation, diarrhea, or unpredictable digestion, or even IBS, which is called irritable bowel syndrome, it's kind of like we don't know what's wrong with you, so we're going to call it IBS. That's a very common symptom of this. Also, if you've ever struggled with some stubborn weight gain or blood sugar swings, or if you've ever eaten a meal and felt like you were 6 months pregnant afterward, then what we call SIBO, or small intestinal bacterial overgrowth, might be the sneaky culprit. So today we're going to be breaking down what SIBO actually is and why it's way more common than people think, the shocking connection between SIBO, blood sugar issues, and metabolism, how to know if you have it, because most people with gut problems don't realize that it's SIBO, and how to clear out bacterial overgrowth without wrecking your gut or your health in the process. So if you've ever been feeling bloated, sluggish, or like your digestion is kind of out of control, or your elimination system isn't quite working right, then let's get to the root of it all. So what is SIBO and why is it so common? SIBO stands for small intestinal bacterial overgrowth, and it's exactly what it sounds like. It's too much bacteria growing in the wrong place. Normally, bacteria live in your large intestine, where they help break down fiber, produce vitamins, and keep digestion running smoothly. But with SIBO, bacteria overgrowth happens in the small intestine, where they ferment your food too early, causing bloating, gas, and even nutrient malabsorption. If you have pale bowel movements or pale poop, for lack of a better word, that could actually really be a sign of nutrient malabsorption. You're not getting the nutrients from your food. So how does this happen? There are quite a few reasons that SIBO develops, but some of the biggest triggers include slow gut motility, like things don't move fast enough. So if your food sits too long in the small intestine and maybe you have constipation issues, then bacteria has more time to overgrow. Also, low stomach acid. If stomach acid is too low from stress or acid reflux medications or a poor diet, it doesn't kill off the bacteria before they reach the small intestine. So you have more bacteria leaving your stomach and heading into your small intestine than there should be. Also, blood sugar imbalances. Blood sugar imbalances can cause insulin resistance, and high blood sugar can disrupt gut motility and fuel bacterial overgrowth. Also, previous antibiotic use. While antibiotics can wipe out infections, they also kill off beneficial bacteria in your gut and intestines that help keep SIBO in check. So if you've ever had to be on multiple rounds of antibiotics, or you feel like you're constantly sick and having to take an antibiotic here, antibiotic there, and you don't replenish your gut with good probiotics either during the treatment or afterwards, then your body can get filled up with bad bacteria. So let's talk about the SIBO and blood sugar connection. What does bacterial overgrowth have to do with blood sugar? And it is actually quite a lot. SIBO, while it can be caused by insulin resistance, can also cause insulin resistance. Chronic gut inflammation from bacterial overgrowth can interfere with insulin signaling and can lead to blood sugar swings. It can also lead to carbohydrate malabsorption. People with SIBO often have trouble digesting carbs properly, and this can lead to blood sugar crashes or spikes. SIBO can also trigger cravings for sugar and processed foods. Certain gut bacteria just love sugar, and it's not the beneficial kind. And if those overgrow, they can actually literally hijack your cravings, which we've talked about before. And bloating and gut distress can make low-carb eating feel miserable. When people are trying to cut carbs for better blood sugar control, but then you struggle with digestive issues because of hidden SIBO, and you're finding that you're being controlled by your cravings, it's just kind of this big old messy cycle that's fueled by some bad bacteria hanging out in the wrong place. So if your blood sugar has been unstable, even though you're trying to eat well, your gut bacteria might actually be a big part of the problem. So let's talk about some signs that you might have SIBO. If you're wondering if SIBO is messing with your gut, here are some symptoms you can look for. Bloating within 30 to 60 minutes of eating, especially after fiber, carbs, or sugar alcohols like erythritol. If you have chronic gas or burping, even when you're eating clean. If you're alternating between constipation and diarrhea, or if you're just having one extreme more often than not. Or if you have food intolerances that seem to be getting worse over time. Also, you could have fatigue and brain fog after meals. You could have unexplained weight gain or difficulty losing weight. You could also have skin issues like acne, rosacea, or eczema, which is like a systemic inflammation trying to come out in your skin. So if you check off multiple symptoms of these, it might be time to dig deeper into what could be going on. So how do you know if you have SIBO? How can you test for it without guessing? If you suspect SIBO, the best way to confirm it is with a breath test. That's probably the most easiest way, I should say. This test measures hydrogen and methane gas levels in your breath after drinking a sugar solution. Why? Because the bacteria in your small intestine ferment that sugar and release gases that shouldn't be there in high amounts. So there are two ways to test for SIBO with your breath test. You could have a clinical lab test. This is usually ordered by a doctor, usually a gastroenterologist. Most primary care doctors won't do this unless you see maybe a functional medicine doctor. They might dig into this. But the majority of primary care doctors do not feel qualified to run this type of test, so they will refer you to a gastroenterologist. Usually this type of test is a lactulose or a glucose breath test. It requires fasting beforehand and drinking a sugar solution. Sometimes they may have you go on a certain type of diet for a certain amount of days before doing testing, especially if they want to do some type of scope or something as well. And this test usually takes 2 to 3 hours with breath samples collected every 15 to 20 minutes. Results from the test will show whether you are negative or if you have hydrogen dominant, methane dominant, or mixed type SIBO. This is important because depending on what type you have, there can be different treatments or healing diets that they want to put you on depending on your type. You could also use an at-home breath test like FoodMarble. FoodMarble's AIRE device, AIRE, is actually a portable real-time breath test that lets you check fermentation levels at home. And it's actually covered by HSA and FSA funds if you would like to buy one. It uses a similar process. You fast the night before, and then you drink a test sugar, and you breathe into the device at different intervals. It's also great for tracking progress over time if you do get diagnosed with SIBO, either from a doctor or at-home testing, because it allows you to check more often. Especially if you're treating SIBO naturally, it's nice to be able to have something that you can check, every couple months. And this can also help identify which foods trigger fermentation in your gut, because they do have you can get a little, food intolerance kit as well, that can also check different types of sugars and see what's causing issues for you. So same as a clinical test, you're going to fast the night beforehand, 8 to 10 hours. You do a baseline breath sample before you do your test sugar. You drink the sugar, take samples every 15 minutes for 2 to 3 hours. And then it'll show you in the application on your phone whether you have hydrogen or methane spikes. And if the levels rise too early, that's a sign of SIBO. If it rises too early, it's because it's fermenting in your small intestine instead of waiting until it gets to your large intestine. So if your test is positive, you know that gut bacteria are hanging out where they shouldn't be. And if it's negative, other gut issues like low stomach acid or the catch-all IBS could be causing your symptoms instead. But at least you will know that it's not SIBO, because it's really difficult to move forward and treat other issues and heal your gut if SIBO is part of the problem, because SIBO usually has to be dealt with first, and then you can deal with the gut repair and all those other things. So understanding whether or not you have SIBO is a really big part of the problem if you think that you might have it. At-home testing makes it so much easier to stop guessing and actually start addressing those issues with confidence. So let's talk about, if you do end up positive, how do you get rid of it without destroying your gut and causing massive systemic inflammation in the process? So if you find out you have SIBO, the internet is full of different quote unquote kill protocols for SIBO. But aggressive antibiotics or extreme diets can sometimes cause more gut damage in the long run. So unless you've been tested by a doctor who scoped you, which is when they they'll actually take samples and see how much bacteria you have in there. And then they might recommend aggressive treatment. But unless you've had that type of test done, natural rebalance is effective for most people. But just an FYI, severe SIBO can cause fatalities if it's extremely aggressive. So make sure to get in and see a specialist if you're having severe symptoms like cramping or colonic or intestinal seizures that have you on the floor in pain, or severe constipation for days or weeks on end, or diarrhea. Any of those major severe symptoms, you definitely want to get seen by a specialist, and make sure that you're getting checked out, because SIBO can be fatal if it goes untreated. So, but if you don't have any of those major symptoms, if you fall in the category of those with just slight symptoms, you can focus on gently rebalancing your gut with a more sustainable, low-key approach. So first off, you'd want to start with supporting your stomach acid production. Low stomach acid is actually a big root cause of SIBO. And you can also understand this as a side effect of long-term use of acid reflux medication. If you've had to be on antacids or acid reflux medication for a long time, you could actually be causing, those medications could actually be causing SIBO on the flip side of that, because many times acid reflux is actually caused by too little stomach acid. And it's coming up because your stomach acid is so low, it's not activating that valve that closes your stomach off. And so a lot of times low acid causes reflux, and people are put on medications to give them lower acid, and it just makes the whole situation worse. So something you can try is adding lemon water or apple cider vinegar before meals, and that can really help with digestion. Obviously, if you're on a medication, don't just stop it for no reason without talking to your doctor. But if you would like to start switching to something more holistic and seeing if you can get off of those medications that cause low stomach acid, you could just talk to them about that. See if they're open to letting you stop it or go off of it for a short period of time and try switching over to something like lemon water or apple cider vinegar, something that would help you regulate your stomach acid better and help prevent bacterial overgrowth on the other side of your stomach. Another part of this sensible treatment approach is to improve your gut motility. So eating on a schedule, walking after meals, and using gentle prokinetics like ginger or magnesium can help food move through the intestines properly. You should be having at least one bowel movement a day, if not 1 to 2 poops a day. If you're not, then things aren't moving fast enough. So magnesium lotion is actually a staple in our home to help keep everybody regular. But irregular bowel movements can cause bacterial and toxin backup in the intestinal tract, and that can actually cause SIBO or make it worse if you already have it. So make sure you keep that poo moving. You could also temporarily reduce fermentable carbs. I know in previous episodes, we talked about adding probiotics into your diet and adding fermented foods. And typically for everyone, that's totally fine. But if you are dealing with SIBO, sometimes people feel better if they stop on those things for now because they're being fermented in the wrong place. So if you find that doing a lot of yogurt or fermented foods is actually causing you a lot of discomfort, try holding back on those and stopping those while you deal with the SIBO issue. And then you can slowly reintroduce them later to help with gut healing on the other side. But sometimes stopping that can actually help when you're dealing with SIBO. You could also use targeted herbal antimicrobials. So instead of hardcore antibiotics, you can use more traditional, like Chinese medicine style herbs like oregano oil, berberine, and even neem can help rebalance gut bacteria without wiping out the good guys. Herbals tend to be way more targeted and gentle in the way that they deal with issues. So, those are fantastic options for a more gentle approach to dealing with bad bacteria, because good bacteria likes it, bad bacteria doesn't. So bad bacteria will die off when you're taking herbal based tinctures, but good bacteria will actually flourish because it likes that herb and seed plant based type of stuff. Now, you will want to avoid those 3 herbs if you are pregnant or breastfeeding. So if you're pregnant or breastfeeding, garlic and onions can be good alternatives during that time, and ginger in moderation. And then once you're done with that period of your life, you can switch over to something more like oregano, berberine, or neem. And lastly, after you've done that, you're getting everything where it needs to go, as fast as it needs to go, then you can start rebuilding your gut microbiome. After you've reduced that bacterial overgrowth, you find your elimination system more well regulated, you're not feeling as bloated after meals, you're not having lots of cramping or anything like that, then you can start bringing prebiotic and probiotic foods back in to restore balance. Fermented foods, resistant starches, high fiber veggies, cultured dairy. Now, cultured dairy is a huge word in the SIBO world, and it's different than yogurt in the sense that it's homemade and it's very specific in how it's made. So if you look up cultured dairy versus yogurt, you'll find different recipes. So cultured dairy is very popular in the SIBO healing world because it has different properties than like a store-bought yogurt. So definitely check that out as well. But overall, just know that SIBO healing takes time, but it is 100% worth it. The goal isn't just to kill off the bacteria, it is to create a gut environment that naturally stays balanced long term. So, what about SIBO and the low-carb lifestyle and what you need to know? Many people who go low-carb to stabilize blood sugar, all of a sudden they start having some issues and they're not sure what's going on. But many of them may have undiagnosed SIBO, and they may start experiencing that they're feeling worse before they start feeling better, as bad bacteria starts dying off, or they feel temporarily bloated from having high fat meals if their gallbladder function has been sluggish, or maybe they're missing a gallbladder. In that case, you want to supplement with digestive enzymes or papaya, which is a natural source of enzymes that can really help. May also find constipation or diarrhea due to gut bacteria shifts. So sometimes when people don't know they have SIBO and they will go on a low carb diet and then they'll start having digestive issues, and SIBO can actually be the root cause of that. It's just been hidden by a carb heavy lifestyle that feeds all that bacteria. So now that the bacteria is starting to starve off, you can start having more symptoms. So that's one reason we advocate for easing into a low carb lifestyle gradually. Sudden drastic changes in lifestyle can cause a shock to the gut and the microbiome. So slower transitions allow your microbiome time to adjust and allow your body to kill off that bad bacteria at a more sustainable pace so that you're not overwhelmed by toxic die-off or bad symptoms, or like we say, the keto flu, like you're not overwhelmed by all of that because your body's having time to adjust as you go along. You also want to focus on gut-friendly fats, healthy fats like avocado oil, olive oil, coconut oil. These are usually easier on the digestion than processed seed oils, like we've talked about before. Seed oils are very inflammatory. So the more you can shift towards avocado and coconut, the better. You can also include some gut healing carbs during your transition. If you're transitioning to the low carb lifestyle, adding some carbs is fine because you're in the transition process. So you can try using more gut healing carbs like green bananas or cooked and cooled potatoes. If you cook them and then cool them, it actually changes some of the property of the potatoes. And plantains. And all of those can feed good bacteria without super spiking your blood sugar. So anyway, the last one will be support bioproduction. So if you feel nauseous after fatty meals or adding digestive bitters or ox bile supplements, or like I mentioned previously, adding papaya or any other type of digestive enzyme can really help your body break down fats properly. And so all of that said, healing SIBO and balancing your blood sugar can go hand in hand. So it's all about finding the right balance for your gut. So if you've been struggling with the bloating, digestive issues, or blood sugar swings, SIBO might be the missing piece of the puzzle that you'll want to look into. So let's talk about some key things from today's episode. SIBO is super common, but it often goes undiagnosed. And most people probably have never even heard the term. But it's actually deeply connected to blood sugar, metabolism, gut health, and overall systemic inflammation, which, as we know, the higher your inflammation, the more likely you are to deal with blood sugar issues. So it all gets tied together. And healing takes time, but gentle gut support can help restore balance naturally. Now, if you are having severe symptoms, obviously get checked out by a gastroenterologist or somebody else who has SIBO as a specialty, and get them to check you out, get them to do those tests or get some tests at home. And yeah, that's it for SIBO. So next week, we're going to be diving into our last episode of our gut health series. And so you definitely don't want to miss it. And then we'll be getting back to some of our normal stuff. I hope you guys have enjoyed this. I hope it's given you a bigger view of your body as a holistic unit rather than individual pieces. Anyway, if you like this episode, please subscribe, leave a review, and share it with a friend because it helps more people get the info they need. So until next time, take care of your gut, and your gut will take care of you.